The top 3 things we're seeing right now in the pediatric ER are influenza, mostly influenza A, RSV, and gastroenteritis, which appears mostly to be norovirus. For all 3 of these, we are seeing multiple family members impacted, and they are not having a good time. The mainstay of treatment for all 3 is going to be supportive care. There are no antibiotics for any of them. With influenza, there is Tamiflu and other antiviral agents, but they generally need to be started early, and sometimes you have to meet certain criteria, so talk to your doctor about that. If you are exposed to norovirus or other gastroenteritis, it is really important that you use soap and water to wash your hands and not just hand sanitizer. Because of the structures of these viruses, it's not killed by the hand sanitizer. And to sanitize surfaces, you have to use bleach. If you're going to wash laundry that's been impacted, wash it on the hottest setting that you can. And if possible, also use bleach. The main symptoms with norovirus are vomiting, diarrhea, abdominal cramping, fever, and fatigue. And you can be pretty miserable. It can be pretty violent symptoms. For influenza, all of the symptoms: cough, congestion, fever, nausea, vomiting, diarrhea, headache, sore throat, backache, body aches, like pretty much anything. Really bad fatigue. Just, you're miserable with the flu. I can't stress enough how terrible the flu is. You're going to feel like you're dying with the flu, which is really important. If you haven't gotten a flu shot, consider it, please. Infants and younger kids with RSV often have cough, runny nose, wheezing, difficulty breathing. You can have some vomiting and diarrhea. You can have fevers, but you don't have to. For RSV and younger kids, we do have a preventative treatment called Beyfortus. It is not a vaccine, it is a monoclonal antibody, and it seems to be really effective. For kids that are not eating food, especially younger kids, they're going to need a beverage that has sugar and electrolytes, and it should be electrolyte balanced because their kidneys are not mature enough to deal with the imbalances. Pedialyte's a great choice. They also have dye-free options or the World Health Organization oral rehydration solution. If you are headed to the emergency department, expect that there will be a wait. Make sure that you bring a phone charger because I promise you we do not have extras.